And welcome back. Well, if you've got painful leg symptoms like restless legs, swelling, bulging veins, even ulcers, our next guests want to make sure that you're treating the root problem and not just managing the symptoms. Old methods of treatment can cause unnecessary suffering.
But new FDA-approved therapies have much higher success rates and far fewer side effects. Here to tell us all about it is Dr. Charles Moak from Allure Medical. They're a Detroit-based company excuse me, that expanded to the Milwaukee area. Good morning to you.
Yeah. Good morning. And first I want to say I'm coming out pro celery juice.
Thank you. Have you tried it before?
Oh yeah, I have that every day.
Do you? Good.
Yeah, so it's only 40 calories, tastes good.
Yeah.
So you know, what we do is, a lot of people think of it as varicose veins, and that's really what the first procedures were designed to treat was varicose vein, where people have unsightly veins in their legs, those bulgy, ropey veins. And this was really about 2004 and 5, and then we discovered that a lot of other conditions are related to the same thing that we didn't know about before because we were only treating these things. You know, restless legs, had venous like ulcers, those like wounds that keep people get on their ankles, and affects about 1.5% of seniors. And the treatment we've been doing up until the past 10 years was a technique called the Una boot, which was invented in 1890 in Germany by Dr. Una, and that's still done today, about 20 to 1 over treating the underlying cause. So in 2016, for example, it's estimated we spent about $16 billion in the United States treating the ulcers with these boots and wound care and hyperbaric oxygen. We only spent about $2 billion treating all the causes, which would make it go away forever. Yeah. That's really kind of focus on is more the uglier legs rather than just the pretty legs with a varicose vein on it.
Yeah, because you want to take care of the root problem, and that really matters. Why did you guys pick Milwaukee, you know, from expanding from Detroit?
Well, a few reasons. Is because, you know, we're close. That was one thing. It's easy, and also we looked at areas that there's some cities that are really doing pretty well in terms of converting from a wound care model to a wound cure model.
Yeah.
And we're going to cities that they're not quite there yet, and just give them a little boost. So we move into a city, get a couple of locations, and then change the behavior of the doctors so they stop referring these patients to wound care centers and get them fixed.
Yeah.
So what are people complaining of related to these symptoms? Because it makes so much sense to not just treat the problems that people are mentioning, but to actually cure the problem so it goes away.
Yeah, it's a great question because really a lot of people don't actually get the sores, but before it didn't until they're much older. But it starts out with just having like some achy legs or swelling and tiredness, and they're really not supposed to feel that way. A lot of people don't know that it shouldn't feel that way. Then they start getting heaviness at the end of the day. You know, we talked about restless legs. That's why they feel kind of shaky at night and jumpy. Then sore legs, and then these little brown spots start appearing. If you get to the point where you start having discoloration on your inner ankle, you will eventually get that sore. It progresses over time. So that's like, maybe don't let it go any further than that.
Okay. So how simple and easy is it to treat it then? Instead of this, you know, wound care to the wound cure, like you were saying, what is the treatment? How do we fix it?
The old-fashioned treatment was we actually cut the vein out, and that wasn't that popular, it led to problems. So now we find the vein that's causing it. There's usually 1 or 2 veins that are causing all these problems. They're just not working properly. And you have plenty of other veins in your legs. So we find those with ultrasound, we put a little device in it, and we numb it up with a solution of lidocaine, make it totally numb, and then it gets burnt. Doesn't come back. It's done outpatient, no anesthesia. You can go jogging afterwards. Really nothing to do. It's
you have to wear like a compression stocking?
You know, you can, but the studies show it really doesn't make much difference. So you can if you want to, but not really necessary.
Does insurance tend to cover it?
Yes. Yeah, they cover it
if you're
having symptoms. If there's like, because you have ugly vein, if you have varicose veins that don't hurt, they won't cover it. We're seeing most people that have more advanced disease, and we know that once we treat that, we kind of stop all the other problems that occur down the road.
So really, if you have symptoms, if it's causing you some problems, some pain, chances are very good that insurance will cover it.
Yeah, typically they will, and there's a whole spectrum of it. It starts out with just like, you know, spider veins. Not really, there's no medical necessity to treat those. Varicose veins with no symptoms, they're fine. It might never get worse. But once you start getting swelling, they start hurting, it gets worse at 4% per year.
Wow.
Okay, they only progresses in one direction until we stop, and then it's gone, typically forever.
Yeah, that's great. How did you guys become these vein specialists? What's your background to do this?
Yeah, so I was doing a cosmetic surgical practice, and we were treating people with varicose veins. We were treating with foams and stuff that was invented in Europe, wasn't available here. And then it started becoming something that became more mainstream in the United States. The FDA approved it locally, and I started getting patients with worse and worse medical legs. Really converted, segued from the cosmetic side of the business into people with really unhealthy legs. That's where our sole focus now.
So it's almost like you tried to treat them cosmetically, but the problem kept persisting, so you knew that you had to do
Actually, we treat
more.
them cosmetically, they'd get better. But we started seeing people with worse disease
Gotcha.
And then we got right about 2005 is when insurance started recognizing this and paying for it, and that kind of transformed what we were doing.
I see.
I'm wondering how people know if they're a candidate for this. You do a free screening, right?
Yes, we have a free screening where you come in, we just kind of take a look and ask some questions. We can tell whether or not there's an issue. Then the next step is there's an ultrasound. That's a painless procedure. We look through the skin, and we can identify where the cause is at and talk to you about what's the solution, how significant is it.
Talk through the options as vein specialists. I think this is wonderful because so many people suffer sometimes for years not knowing that there's not just a way to manage the symptoms but a cure for this problem, which is really good news. So for more information or to schedule that free vein screening we just mentioned about, be sure to visit getpainfreelegs.com, or you can call this number to schedule 262-239-7399 today. Great talking to you.
Doctor.
Thank you very much.
Time.
Appreciate it.